another live session. And the purpose of today live session is just to show around. This is brand new clinic, just opened in July of 2023. It's been in works for at least 2 years because we wanted to get the best equipment, the best environment for our patients. And we took time to research, to get to get the equipment, materials, and everything. So, yes, it took longer than we expected. We first planned in 6-7 months, and we ended up opening after 2 years. Anyway, we still do some minor improvements. If I see something I can do better, we call our contractors to do some work on Saturday, Sunday if necessary, just minor stuff. Anyway, this is our consultation room. The consultation room, we have one computer with the microscope connected, and this is something I use to evaluate the reason for the hair loss. And we have another screen right here that if somebody's coming with the family, they can look at the screen of the computer and they can see the screen on the TV that is connected here. So everyone can pretty much be engaged in what's happening. And it helps for me when I do my my microanalysis to see how it works right here. When I do my microanalysis, I can work from any angle and see the picture on the screen. Okay, because we do design hairline during our consultations, I have a light here that helps me to take some pictures right after the hairline design with the iPad, show it to the patient. And the nice thing, we have this big mirror, and when I do my hairline design, my patient can turn around, take a look from different corners, make sure that the hairline design that's something that he or she is looking for. Right, I have my optics right here, so it helps me to get the measurements correctly and see all the details of the area that we're going to be concentrating on. Okay, so this is again the consultation room. I have some of my diplomas. It's only probably half of what I have, but we wanted to not to get too many items on the wall anyway. So you can follow me now. Here's our hyperbaric center, and this is, I call it the pinnacle of the evolution in hair restoration. Why? Because this is treatment. This treatment can address many challenges that we face during hair restoration. Some of the challenges are reperfusion injury, because we take grafts from one area, replace to another. It creates a problem with what we call in medicine reperfusion injury. It effectively can address that. It helps to reduce postoperative swelling, edema, and improve circulation to the recipient area. It helps to fight infection. It helps with regeneration. It helps to stimulate hair follicles. So a lot of these things can be improved just using hyperbaric oxygen therapy. By the way, in a month, I'm going to Monaco to present the topic specifically addressing is there a place of hyperbaric oxygen therapy in hair restoration. So stay tuned. So if you can follow me here, let me show you. This is what we call a hard shell hyperbaric chamber. It's hospital grade. It's not an inflatable chamber. We are capable of achieving 3 atmosphere of pressure. And the more pressure we can achieve, the more oxygen diffusion can go in every cell in our body. And we can get up to 8 times, depends on the pressure, of oxygen delivered to every part of our organism. This is the table where me or technician sits to supervise. So every treatment is being supervised by a technician. We stay every minute with the patient here. This is the area right here for patient to change before and after the procedure. We can check vital signs before going into the chamber, going out of the chamber. I can take a look in the ear, make sure everything is good before and after the chamber, and so on. So this is truly make us very different from the rest of from rest of hair transplant facility, because it can help with faster recovery, and we've seen 75% faster recovery after surgeries if we incorporate it with hyperbaric treatment with the hair transplant procedure. What makes it really unique, that we can use hyperbaric treatment on the same day before the surgery and after. That's what really makes it unique. So if you can follow here, this is our surgical room. And we do non-robotic cases here. We have a second room with the robot. But here we do either small cases or PRP, regenera treatments, exosomes, PRP treatments, and some of the smaller hair transplants. Okay, the nice thing here, we have an area where the grafts are being counted. We use microscopes with built-in camera, so everything is being shown on that screen. So when I'm working, harvesting grafts, I can quickly take a look at the screen and see how grafts are doing, what's the situation with the progress of counting and what the numbers are. And big point, okay? When you're looking into hair restoration, it is important to make sure that doctor, not technician, not assistant, not the nurse, but actually doctor does your procedure. Not standing, looking, supervising, but actually hands-on harvesting, implanting. Because if you go to have any surgery, appendectomy, I don't know, heart surgery, will you feel comfortable if not the doctor, but some assistant does the surgery? Probably not. And I think this is important because this will determine how we look for the rest of our lives. So when you're researching who does the procedure, these are important questions that needs to be asked and needs to be specific. Who does harvesting? Who does implantation? Okay, and you want to hear that's only doctor, nobody else. Okay, so here again, it happens exactly the way I just described, but I want to be in control also how the grafts are being counted. Are they in the moisture environment to prevent dryness and damage? So I can always check it with the camera. It's being recorded, so my assistant know that everything what was done is closely monitored. Okay, so let's follow here. This is the room. We have some staff lockers. We have a patient locker right here. But this is the room where the preparation before the surgery is being done. Why do we like this shape? Because it's not enough just to put alcohol to disinfect the area. We want to achieve the ultimate cleanness of the area. We want to make sure there's no bacteria remaining on the skin. So what we do, we actually do the entire wash of um, all the area, and we use chlorhexidine soap to kill all the bacteria. And then on top of it, we use alcohol. So it's very useful to have this washing station right here. Okay, so let's go to the next. The next room is our hairline design room. So before the surgery, I like to see patients the day before and design the hairline. Again, we are a patient-centered facility. That means that you're not going to a meal clinic where you're going to have 5 people sitting in the waiting area and you have 5 rooms running surgeries and you have just one of these multiple questions. We decided that our patients deserve the best. And what that means when it's patient-centered, that means you are, as a patient, at the center of everyone's attention. And our staff is working around this one patient, one surgery per day. And we are paying undivided attention, including me, to this one person. So here, what is important, because I like to see patient the day before. We discuss the design of the hairline. I draw the hairline. My patients are able to see it. There is a light here, so it's all concentrated in this area when the patient sits. And then he or she goes home and has an opportunity to discuss it with her or his significant others, make sure that this hairline is exactly what he or she likes. And then the day after the day of the procedure, my patient is back and we talk again. And in case he or she tells me, let's adjust a little bit here, let's change the shape a little bit. And so we have the opportunity to do that, okay? So this is one of the things we really, I think it's important to make sure that hairline design is exactly what my patient is looking for. And doing it the day before really helps to achieve that. Okay, let's go next part. So here we have a little recess, and that's where we take before and after photos. So we want to have the same environment when we take pictures before and after, because when we compare, we don't want to see green background versus red background, different lighting versus other lighting. No, we want to see exactly the same lighting. We want to see exactly the same background and exactly the same background lighting too. So we have a direct lighting from here in the background. So we have no concerns about different differences that might affect the areas. Okay, so I'm going to the next room here. This is our main operating room, and tomorrow we have a surgery. We do it's a smaller surgery, about 1,000 grafts. We'll be working in on the frontal hair restoration. So we do start some preparation now. Okay, you can come in here. So it's set as similar to the other room, except we do have our ARTAS robotic equipment here. And it's one of the things that we do offer to our patients, to have an option to have it harvested robotically. I wanted to make sure that in our practice, I have pretty much every main well-known machinery, I would say equipment. So we have Devro, we have Mamba by Dr. Ciavarini. It's a great device. We have Neograft. I have Coles instruments too, and I do have Harris. So pretty much all the most known manufacturers of hair transplant harvesting devices. We have it here. And I use it at my discretion based on each patient morphology, hair morphology, because everyone is different. So having more options, it's always helpful. And it is important for physicians to get comfortable using multiple devices because each one has their pros and cons. And that's what we here for. Okay, that's what we do to get the best care possible with the best equipment possible. So in this room we have a real operating table. It's very comfortable because it can be, I can use my patient in any, I can tilt to the right, tilt to the left, get into Trans-Brandenburg. So when I harvest, and the case can be real long, 3,000 grafts, so that means I have to harvest 3,000 times hair follicles. So me being comfortable is as important as patient being comfortable. Because if I'm not comfortable sitting for 3 hours harvesting, it might be reflected with the results. So for that reason, I'm using this chair, and this chair was actually designed to be used in neurosurgery initially. Why? Because I can have my elbows rested and I can sit completely straight. My back is supported, my elbows are supported. So imagine if I have to sit like this, holding my elbows in the air for 3 hours, trying to get the grafts, well, how long I'm going to last? Probably not very long. But when I use this special chair, I can sit right here, right in front of the patient. My elbows are supported. My back is not strained, right? I can do it for 5 hours straight and still be ready to go for the implantation part. So, the rest, we of course we monitor every patient, vital signs. We place an IV before we start the procedure in case we rarely use it, but in case we need, because it could be a long day, in case we need to give some IV fluids, IV therapy, vitamins, we can do it. We give oxygen during the procedure, and the same principle, same microscopes, Mantis microscopes with built-in camera connected to the display, and it's being monitored. So my goal is always to control what's happening around the patient. And this is the reason why I spend every minute with my patient instead of delegating to someone, because I know that grafts are being kept at the perfect 8 degrees Celsius, right? They never get exposed to the dryness. They never been treated roughly, because anytime, just imagine, graft it's a small piece of live tissue. If it been handled with forceps inappropriately, too rough, squeezing too much around the bulb area, around the bulge area, it can irreversibly damage the graft, and as a result, it will not grow. But actually, I'm thinking about creating a video of different case scenarios why hair transplant fail, okay? And that's something we're gonna start working soon. So I will go over all possible reasons, and I hope it helps other hair transplant doctors to make sure they know what they're looking for to avoid these mistakes that can result in poor or failed results of the procedure. So, one thing I wanted to mention, we are striving to work in sterile environments. So we use sterile gowns, we use sterile gloves, we use sterile equipment. But I wanted to go even beyond this. So all walls of these both operating rooms are made from a special artificial stone called Carian. And what is good about the stone, it makes it naturally antimicrobial. Of course, we clean it after every surgery, but again, if you look around this area, we wanted our operating room to look very clean, sterile, so there's no chance of any type of infection. All right, so I hope it shows some of the operating rooms. So there's not much to see here. It's our autoclave room. It's small. We have PRP processes equipment. We do have a control of every PRP sample, and that's what makes this big difference, because when it comes out of centrifuge, PRP just looks like a gold yellow colored fluid, right? You don't know how many platelets there are, and what actually works is not the fluid, but the fact that the platelets are in certain concentration. So we do have a CBC analyzer. So every sample of PRP that's coming out is being checked and verified that platelets are at certain concentrations. So, and we give it, and this is the validation for the patient and for us that what we do will actually work. All right, so here we have a smaller, that's our third procedure room. It is a smaller procedure, frequently used for SMP, scalp micropigmentation, can be used for PRP, smaller, less invasive procedures, such as exosome injection. That's something we're going to offer, injectable dutasteride and others. So it's nice. It's same clean with a nice lighting and so on. So, and here our work area. So our assistant right now working on preparation for tomorrow's surgery. We do have a consultation going on right now, so we're going to keep a little quiet. But let's go to the second floor, and let me show you what we did on the second. So this is our reception area. There are some seating on this side. There are bar stools on that side. So when you're waiting for your appointment for consultation, you can have a coffee. We have a coffee machine there, some water, and this is the working area with some more chairs. Okay, so let's go and check the second floor. So for now, we have to walk outside. It's almost March, I guess end of February. You can see how nice it is in Florida. If you look around here, so behind this big building right here is actually a public beach right there. So you can walk between this building. It takes me 3 minutes, and you're right on the ocean, on Atlantic Ocean. This is really cool because if you stay here, and we have a patient suite upstairs, you can stay in the patient suite. You can be here with your family, and you can walk 3 to 5 minutes and get right on the beach. And even in February, I think it's about 85 degrees today. Very comfortable. I think in the clinic it's much cooler now than actually outside. All right, so come on. Okay, so this area is going to be a second reception. It's still, we're still waiting for some furniture, but it's pretty much ready. Let me see. So here, let me show. All right. So have your procedure. Why it is important? You can just walk to, have your to the suite, walk to the beach. Treatment again twice, so we recommend to have at least 5 to 6 treatments around the procedure to the best possible